Florida legislature passed the Infectious Disease Elimination Act in 2019. Now, that act allows county commissions to authorize sterile needle and syringe exchange programs for people who inject drugs. Disease prevention is the goal. Dr. Raul Pino is here from the Florida Department of Health in Orange County to give us some insight on the benefits of a needle exchange program. Dr. Pino, thank you for being with us.
Thank you for having me.
Why do we even need this?
So we have a percentage of the population that is experiencing addictions, and some of them use needles as a way to intake the drugs that they are using. But those needles are also a vehicle through which some infections can be transmitted if the needles are not clean or they are shared between individuals.
What kinds of diseases are we talking about that can be spread to a larger population?
So, HIV is one that comes to mind.
Okay.
And be important the fight that we are engaging in our county to reduce the number of infections. Hepatitis C can be also transmitted through needles, and another range of infections, but those are the ones that we are most concerned about. But what is also important to realize is that the people who are experiencing addiction not only are experiencing addictions, because the act also calls for mental health screening and for other services, and it's what we call syndemics, meaning people are experiencing multiple type of pandemics or epidemics at the same time.
So the act provides for services other than just clean needles and syringes.
The act calls that needle exchange should not happen in the vacuum. The other services that are surrounding the population should be offered to individuals who are experiencing addiction.
What about the argument that we are encouraging people to continue using by providing clean needles and syringes, because there is a part of the population that may feel that way? How do you address that?
And that is a fair concern that we should constantly address. The data demonstrate otherwise. So this expansion of the services for needle exchange program across the state comes after 25 years of experiences in other states, but also after a pilot that was done in Miami. And the pilot demonstrated that contrary to what could be a normal belief, needle exchange program reduce addiction and reduce the feasibility of transmission. But also what is important is that we are there, engage with those individuals from when they are ready for recovery. And sometimes recovery and being ready for recovery is just a click, and it may not last too long. So it's important to be there to say, are you ready to engage in recovery?
You have to be there at the opportune moment.
You have to be there.
So how does this benefit the health of residents in the county overall? Or does it?
It does. So the people who are experiencing addiction are not isolated from the community. They are our family, they are our brothers, they are our sisters. But also some of them may be engaged in commercial sex work. And people who are engaged in commercial sex work may be having unhealthy behaviors with others that are living in our communities.
Okay. Unprotected sex with people who are already infected with HIV and hepatitis C. Okay.
So it's important. It's not only to protect these individuals, but it's also to protect the population and the community at large.
So let's talk about the opioid crisis. How does this program impact that problem?
So in many, many, many ways. The first is that through the needle exchange, we can, again, engage with individuals, educating in opioid overdose, providing with Narcan, and educating on how to reverse an overdose. But also it serves as that time when we are ready again to engage with it. Because to be able to, people don't want to experience addiction. People want to be healthy by nature. So the fact that we are there, the fact that they trust us, the fact that we are engaged means that we are a presence when they are ready to engage in recovery.
So this sounds like it's an education program as much as it is a prevention program.
It is. It's education, it's prevention, it's treatment.
Okay. Thank you for shedding some light on that.
Thank you very much.
Sharing needles, syringes, or other drug injection equipment puts people at risk for getting infections. And studies show that exchange programs reduce overdose-related deaths and prevent diseases like HIV, hepatitis A, B, and C. So be careful.